Royal Mail Group has worked with national charity Mental Health Foundation to produce a series of short films about mental health and wellbeing for staff. This film is about the things you can do to look after your own mental health.
Everybody has mental health, and there are lots of things that affect people's mental health. Not all of those we can control. Taking responsibility for your own mental health can help you feel more in control, and that's key to stress relief, it's key to recovering from a mental health problem, and it's key to leading a satisfying life. There are many things that can help us improve our resilience, and there's a good evidence base for these. Being relaxed when we go to bed is really important. It helps us drift off easy and gives us a better night's sleep. Making your bedroom a place which is comfortable and welcoming to sleep is extremely important. There's a temptation to have all sorts of devices with you in the bedroom, TV, iPad, phone, but actually just before bed, looking at bright screens can interfere with your sleep patterns and make it harder for you to get to sleep.
A friend mentioned to me that maybe keeping a sleep diary would be good. So I started keeping a sleep diary and noticed that every time I Googled late at night or watched TV programmes or spent time on my iPad in bed, those were the nights that I was finding it really, really hard to sleep. Yeah, I decided to make a couple of rules for myself that just helped with my sleep. So no TV at least an hour before going to bed, and just not texting late into the night. Things like that, rules that I implemented, really did help with my sleep and my mood generally the next day.
Stimulants can affect the quality of our sleep, so if we take things like nicotine or alcohol or caffeine shortly before going to bed, that can make it harder to get a good night. If you find you can't give up stimulants in the evening, at least try and leave an hour or so between your last one and the time you go to bed. It's also a good idea to avoid heavy meals or sugary snacks right before bedtime.
Exercise is more than just your physical health. It really does help your mind, your memory, it boosts your mood. It's really about just movement and finding ways to move your body that are comfortable for you, that are enjoyable for you, that progressively challenge you so that you get a sense of achievement out of what you're doing. Alternatively, if it's just a case of doing more, moving more and getting more oxygen into your body just to feel good.
I had quite low mood and I suppose depression due to a bereavement, and I went to the GP to see what options would be available, such as medication, etc. And although we did talk about medication, antidepressants, he also recommended in the meantime, while waiting for the antidepressants to kick in, to try exercise. I was really quite shocked, quite surprised that the GP would prescribe the gym or suggest the gym for me. It's really given me a lot of energy, it's made me happier, and it's made me not dwell on things in the past. And certainly I've met a lot of really good friends through it.
Cycling has really helped me in terms of dealing with feeling a bit gloomy or feeling stressed out. I'd really recommend it to anyone. Quite a good feeling of arriving in work, having had a bit of a workout. And then if it was a particularly bad day, a good way of really cycling hard and letting off some steam physically on the way home, and that's really helped.
Mindfulness is about living in the moment. Taking a moment just to be in the present allows you to come out of automatic pilot. So many of us are going through our everyday life, thinking about the future, worrying about the past, and not actually being in this present moment. A 50-minute body scan where you can do this standing up, you can do it lying down, you can do it sitting, where you're actually sort of noticing sensation in the body. And also that ranges all the way through to just taking a moment just to pause and just to be grounded in that moment, to reflect where you are, what you're doing, what you're thinking about. Really it's about not being on automatic pilot, which all of us do every minute of the day. It has a real clinical benefit in terms of people dealing with stress, anxiety, depression. It also helps people to manage pain, and it helps people to manage a whole range of different conditions to improve their well-being and to improve their communication and interaction with other people in the family and in the workplace. So if you're interested in mindfulness, the next step is to actually think about possibly connecting with some of the apps that are available, connecting with maybe some mindfulness instructors. There are particular courses that you can go on, and just being aware of what rises for you in terms of your feelings, your thoughts, and knowing that you can observe these thoughts without actually having to get involved. You can be mindful at any point in your day. On your way to work, you can be mindful while you're at work, you can be mindful in your breaks. Just noticing where you are in that moment, what you're experiencing, what you're feeling, what you're about to say, that's being mindful.